Hello, this video is on the subject of pain relief and what creams or sprays, what can we use to help us with that. Now the most common one that is used is EMLA cream. This is a big tube of 30 grams, but you can get the smaller ones of 5 grams if you have a small area, like a upper lip for example. It's 5% lidocaine. And it's good to check whether you're allergic to it by doing a little test patch behind your ear or in this bit in front of the elbow. But if you've had a dental anesthetic and you were fine, you're probably going to be perfectly fine with this one. This one has lidocaine and prilocaine inside, and how you use it, you take the tube out. You can keep it in the fridge, but you don't have to. You would open the tube and you would apply a thick layer, so it has to be white. Okay, I'm actually going to apply to show you. It has to completely cover the color of your skin. So this little bit, you want roughly that thickness. Can you see? You can't actually, my skin you can't see my skin underneath that. It's completely white. So you put the cream on and then, as we say in professional language, you occlude it or you cover it with cling film. Here we go. Because if you don't, the active ingredients will actually evaporate in the air rather than going into your skin. And this is a cream that you can get over the counter in the UK from any pharmacy, but you need to ask for it. It won't be on the shelves. So you ask for EMLA cream and you can get a small or a big tube, and they will ask you what it is for. And you can say that it's for a minor procedure. You can say it's for electrolysis. And most of the pharmacists I've spoken to know what I'm talking about. So they're fine. So this has to stay on for 45 minutes. I find some people do better with an hour, but I have clients that are actually fine with just 30 minutes. And once you will see with time, this is actually kind of sinking in your skin, so it won't be that thick white. It will become more translucent, and then in the end it gets removed and put in the bin. So what you can do really to help yourself if you're finding it painful is apply EMLA cream at home, and if it's on a body area, you can, occlude it really well with a cling film, put your clothes on and come in for a treatment. And if that's difficult, if it's a facial area, if you live nearby the place where you're having your electrolysis done, just literally before you run out the door, you wipe it gently, not all of it, just wipe it gently with the cling film, and you run for your appointment to just really reduce the time that you have between you taking off the cream and you starting the appointment. Do tell your therapist that you've used anesthetic cream if that's the case, so she has an idea that that something's been there, just in case. Now painkillers, oral one, pills, are brilliant. I find that cocodamol works best for most of my clients, but if you're someone that's never taken anything, you might want to try with just paracetamol at first. Not aspirin though, never aspirin. Aspirin is a blood thinner. It's likely to increase the risk of bruising, so you don't want to do that. Paracetamol, ibuprofen maybe, and cocodamol, pretty good. Now another ones that I found similar to this cream, there's a cream called Ametop, but it comes in tiny tube. It's used exactly the same way. Again, it's a dental type of anesthetic cream, but for some people it just works better because it's a different ingredient. I think it's Novocaine, but I might be wrong. And then I found this little beauty recently by someone who recommended it. It's a dental spray. Really, it's designed to work on the inside of the lips and on the gums. So the carrier that's taking it through the skin, that's taking the active ingredient through the skin, it's designed for this area. But it actually works okay on upper lips, especially since it's translucent. But the only way you can get it, I got it from Chemist Direct online. I had to say it is for dental purposes, and they will send you an email and ask what are you going to use it for. So I've said it's just to numb the gums before my dentist puts the injectable anesthetic in. I find it works not as well as Emla, but maybe if you leave it long enough it can work, and since it's colorless, it might actually be alright for facial areas. It has 10% I believe of the lidocaine, so it's a bit stronger. It's just, I think, the carrier that is not designed to put it through the skin. And with this you just spray on. You've got to be careful, you're only allowed 20 pumps of this per adult, and it's called xylocaine. Here we go, I hope that you can read that, xylocaine. Okay, now what other options we have? Sometimes I find people just need a little bit of distraction, and in this case good old deep freeze spray can be sprayed on the area 10-15 minutes before treatment, and if you don't wipe it for about 5-10 minutes, it will allow it to go through the skin, and then it can be wiped and you can work on the area. And it takes the edge off the treatment for people who just, that's all they need. And some of my clients actually quite like an ice pack that I keep in the freezer, and it's just purely by putting it on, it numbs the nerve endings in that area, but also it's quite nice and soothing after treatment to bring the redness and the swelling down very quickly. Okay, I hope all this will help as advice, and it gives you an idea how to use the products for pain relief properly. Good luck, thank you.